Hello and welcome to Khaleej Times. As you know, October is Breast Awareness Month and we caught up with Dr. Aydah, who is Consultant Medical Oncologist, as well as someone who has helped spread awareness about breast cancer through the Women in Pink initiative supported by Novartis. And she's going to be talking to us about breast cancer awareness. Thank you so much for joining us.
My honor actually to be with you all today. Thank you so much.
Firstly, if you could tell us a little bit about the advantages of early breast cancer screening.
Yeah, so definitely breast cancer is a huge burden here in the UAE and the rest of the world. And I think we are gotten better in terms of like early detection because that will increase the rate of cure. Because at earlier stages, like stage 1, when it has not spread yet, the cure rate can be as high as like 95 to 98%. With early detection, it comes less intense therapy. So a lot of patients, they won't need the chemotherapy, if we detect it early. A lot of patients, they won't have to lose the full breast when we detect it early because it's so small that we can just remove the breast, the part of the tumor which is affected and not compromise the whole breast. And definitely there is a less psychosocial burden because less intense treatment. But above all of that, and I just repeat myself because this is very important, early detection meaning better chance for cure. And this is what we need to achieve.
Right. Okay. You spoke a little bit at the summit, at the We the Women Summit organized by Khaleej Times, about factors that can be modified and those that cannot be modified.
Yes.
Could you help us understand that a little bit better?
Just by being a woman, that by itself put us at risk of breast cancer. And then age, the higher the age, the older that we get, the higher the chance of getting, breast cancer. And then we have family history, BRCA mutation, that a genetic mutation that tends to run in family, and it accounts for only 10% of all breast cancer population. So it's not a major issue, but it's still there. And then other factors, including, early menarche, not breastfeeding for those who have babies, not having kids by itself can be a risk. But these are just non-modifiable because we can't, do much about it except for breastfeeding. So now what are the modifiable ones? And we need to focus more on because there's something that we can do, actively do to decrease the risk, including exercise because sedentary lifestyle is very well known. Overweight or being obese, a lot of fat in the body, that by itself can also increase the risk. Using estrogen and progesterone hormones and limiting alcohol, limiting smoke, or don't smoke because smoking, as a matter of fact, it's bad in a lot of ways for the health. So all of these things can definitely help and reduce the chance of breast cancer.
Okay, that's very insightful. Lastly, just one thing I want to focus on is there's still, for some reason, despite so much, we've come a long ways, despite so much awareness, there's still, women feel some sort of social stigma, associated with this disease. What can we do as women to change that?
So that's a very important topic and we encounter it a lot, although it's getting better because of the education and awareness that's happening in the society. I think making more people aware. So when the patient is diagnosed, the ones around her should understand what is breast cancer, what's the chances for cure, what are the treatment options, because most of the support will come from the community, the husbands, the relatives, the community, the friends, the workplace, So the more we spread that breast cancer is a disease that, like any other disease, that we need to deal with it, take the right treatment, and hopefully it's going to be a history. And then we move forward. But going through all of this, of course, the patient will need a lot of support, a lot of courage. And this is where we need to use our voices. Now we know about it, we need to use our voices. And I all the time say how much the social media is powerful when it comes to this. So we need to use it to spread that because it's definitely something important. It can impact a lot of patients in a positive way.
All right. Thank you so much, Dr. Aydah, for joining us. And thank you even more for spreading so much awareness about breast cancer and helping us fight this disease.
Thank you so much. My honor.